To determine hind limb lameness, you must evaluate symmetry of hind limb gait and the relative degree of pelvic excursion when each hind limb hits the ground. Focus your attention on a fixed point of this horse's pelvis. As he trots away and toward you, notice the pelvis elevates or hikes up when the left hind limb hits the ground and settles or drops when the right hind limb hits the ground. As the horse trots toward you, use his top line as a frame of reference. Notice the pelvic elevation or hike up when the left hind limb hits the ground. Drifting away from the lame limb, a common finding in horses with hind limb lameness, is not seen. In slow motion, the pelvic hike up when the left hind limb hits the ground can readily be seen. From behind and from in front, notice the flight of the left hind limb. During advancement, the left hind limb travels medially, close to the right hind limb, and then stabs laterally. This stabby gait is a common limb flight seen in horses with hind limb lameness. From in front, notice the pelvic elevation up when the left hind limb hits the ground. Up, down, up, down, up, down. Once again, in slow motion from behind, watch the pelvic hike up when the left hind limb hits the ground and drop when the right hind limb hits the ground. Up, down, up, down, up, down, pelvic hike, up when the left hind limb hits the ground, and down when the right hind limb hits the ground. From the side, notice the shortened cranial phase of the stride of the lame left hind limb when compared to the right. Using the windows behind the horse as a frame of reference, notice the pelvic hike up when the left hind limb hits the ground, and pelvic drop or settling when the right hind limb hits the ground. While some horses with hind limb lameness shift weight to the forelimbs and show a head and neck nod, in this horse a head and neck nod is not seen. Slow motion video analysis is useful to see limb flight and pelvic excursion, but is not readily available during most lameness examinations. Once again, from the side in slow motion, notice the pelvic hike up when the left hind limb hits the ground and down when the right hind limb hits the ground. Up, down, up, down, up, down, up, down, up when the left hind limb hits the ground. Left hind limb lameness.